Food and fertility. Approximately 10% of women between the ages of 15 and 44 have trouble in conceiving. It may be due to problems with ovulation, blocked fallopian tubes, physical problems with the uterus, or uterine fibroids. Infertility is not always a woman's problem. 18% of men are diagnosed with a male-related fertility problem such as low sperm count or poor sperm quality. Both account for more than 90% of male infertility. Some of the risk factors of infertility for men and women cannot be altered. But behaviors such as a poor diet that have been tied to low fertility rates, can be modified. Fertility of both woman and man is much influenced by healthy, balanced diet with essential nutrients. Bananas are potassium-rich food that keep the blood pressure at bay, and boost both male and female fertility. Bananas contain vitamin B6, which regulates the body's hormones and menstrual cycle. B6 deficiency can lead to poor egg and sperm development. Carrots, this orange-colored vegetable popularly linked to improved eyesight, can also help men in the bedroom when it comes to their sperm performance. A study published in the journal Fertility and Sterility found carotenoid intake was associated with higher sperm motility, and the lycopene, with better sperm morphology. In other words, eating carrots and tomato can boost sperm quantity and quality by up to 8%. Ice cream, the dense and milky texture of this dessert satisfies your sweet tooth, and possibly your fertility. Consuming a scoop of full-fat ice cream can increase the likelihood of ovulation for women. A study published in the journal Human Reproduction found women who ate a scoop of ice cream at least twice a week had a 38% lower risk of an ovulatory infertility. Consuming low-fat dairy will actually lead to an increase in fertility risk. Full-fat milk contains fat-soluble hormones that may play an important role in fertility. When milk is skimmed, these hormones are lost. So, a full-fat dairy consumption is associated with a decreased chance of infertility. Leafy greens, such as salads with spinach, romaine, arugula, broccoli, and other dark, leafy greens can go a long way when it comes to ovulation and sperm. These greens are high in folate, a B vitamin that can lead to healthier sperm and reduce the likelihood of a miscarriage or genetic problems with the baby. A study published in the journal Human Reproduction found non-smoking men with no prior history of fertility problems who had the highest intake of vitamin B had nearly a 20% reduction in the number of abnormal sperm. Lentils, this plant source can deliver an optimal dose of iron, which is known to lower a woman's risk of infertility. A study published in the journal Obstetrics and Gynecology found women who got most of their iron from plant sources reduced their risk of infertility by 40%. Meanwhile, women who took the highest doses of iron supplements, 41 mg a day, reduced their risk of ovulatory infertility by 62%. More research is still needed before iron supplementation is recommended to aid fertility in women. Focusing on a diet that is high in iron and a vitamin C-rich food, the absorption of iron is enhanced. Example is eating a spinach salad, top it with tomatoes, red bell peppers, or a citrus dressing. Shellfish may be worth enduring for your fertility's sake. Shellfish contains B12, which can help strengthen the endometrium lining in egg fertilization and reduce the risk of having a miscarriage. This fish type is also a good source of antioxidant, selenium and essential fatty acids, which protect the egg and sperm from free radicals. Walnuts are a healthy beneficial snack for a man's sperm. A study published in the journal Biology of Reproduction found eating 75 grams of omega-3 rich walnuts led to an improvement in sperm vitality, motility, and morphology for men. Women can also benefit from the consumption of omega-3, making it the ideal snack for everyone. Not only are walnuts filled with omega-3, but they are also rich in polyunsaturated fats and zinc. The omega-3 and polysaturated fats help with the production of hormones, helps to improve sperm quality. Zinc is an important element to increase testosterone. Whole wheat bread improves reproductive health. Whole wheat bread is a complex carb that takes time to digest, which helps keep blood sugar and insulin levels stable. A 2010 study published in the journal Fertility and Sterility found the Mediterranean dietary pattern applied 6 months before conception increased the chance of pregnancy in Dutch couples undergoing IVF treatments. When women had high levels of blood sugar, they were only half as likely to have gotten pregnant. A good rule of thumb is to choose dark foods over their lighter counterparts, such as dark bread over white bread. Thank you.